So thank you so much for joining us for today's webinar that is hosted by the Interagency Gender Working Group's Male Engagement Task Force. Today's webinar is titled Building Bridges, Promising Strategies to Improve the Health of Boys and Men by Promoting Social Connection and Support. Next slide, please. I'd like to briefly introduce the members of the Male Engagement Task Force. They're all featured on the slide here, and you'll be introduced to different members of the task force throughout today's webinar, either as speakers, as panelists, or as facilitators for small groups. Next slide, please. I'd like to share a few webinar logistics for today that'll help to facilitate our session. If you haven't already, please do introduce yourself via the chat. We also ask that everyone keep themselves muted unless speaking. You're welcome to type in the chat to share a comment or ask a question throughout the webinar. The facilitators and the presenters will be looking at the chat and responding to your comments and questions as available. If you experience any issues with technology, please do send a private chat to me, Danette Wilkins, and I'll do what I can to support you. And last but not least, we will be sharing the slides and recording after the webinar. So please know that you'll be able to review and share everything that you learned today with your colleagues. Next slide, please. We're very pleased to offer interpretation for today's webinar and want to provide you with a few instructions on how to use the interpretation feature today. So we ask now that everyone go ahead and select their preferred language for today's webinar, either French or English, and you can do so by following the instructions on the screen. You'll likely see a pop-up window on your screen now, so please go ahead and select your preferred language. Next slide, please. For those of you who might be joining us via a mobile phone, might look a little different. So to be able to access the interpretation feature, please click on Meeting Controls, press the three dots, and then press Language Interpretation to then be able to select your preferred language of English or French, and then click Done. Next slide, please. Because we'll be doing some small group exercises later on in today's webinar, we'd like to ask that you all help us to understand where to put you by indicating with an F to your name if you would like to be in a French language breakout room. If you need to be in an English breakout room, no worries for you to do. It's really those Francophone colleagues that we'd like to make sure are in the correct breakout room. So if you could just take some time right now to hover over your name in the participant area of your Zoom screen, select the three dots in the right corner, and then scroll to rename in the box with your name. We ask that you add the letter F to be able to indicate that you need to be placed in a French language breakout room. And we'll repeat this instruction later on in the webinar just to ensure that everyone is put into the correct language room. Next slide, please. So for those of you who might not be familiar with the Male Engagement Task Force, what it is an information, advocacy, and knowledge exchange network that explores how to better reach and engage men and boys in health promotion and gender equality. We put a lot of emphasis on gender equality in recognition of the ways in which inequitable social, gender, and power dynamics can impact the ways that people are able to learn and adopt health behaviors to be able to have improved health outcomes. We focus on diverse health areas such as family planning and sexual and reproductive health, maternal, newborn, and child health, HIV/AIDS, and infectious diseases. And we're always interested in learning from other colleagues about male engagement across other health areas. Additionally, we engage with research and programming and service delivery to be able to improve behaviors and outcomes across these diverse health areas. For those of you who are new to our events, we really work to develop a strong network across the globe that can continue to identify best practices in research, in programming, in service delivery as it relates to engaging men and boys. Next slide, please. So our objectives for today's webinar are these. First and foremost, we really want to examine the established and emerging linkages between social connection and support and health outcomes among boys and men, as well as emerging and effective programmatic responses. It's a growing area, and for those of you who are already immersed in male engagement field, you've noticed that there's been a lot more intention and thinking around social connection support in the last year. In addition to looking at health outcomes, we're also interested in looking at the potential linkages with gender equality outcomes among boys and men. As mentioned earlier, inequitable social power and gender dynamics have so much influence and impact on health behaviors and outcomes. So it's critical that we also look at this aspect. And the Male Engagement Task Force has developed a knowledge product on this very topic. So this is an opportunity for us to be able to disseminate that knowledge product and share what we've learned over the last year with you all. And to further ground what we've learned, we've invited some colleagues to share their current programming that works with primary and secondary students to address issues linked to social connection and social support among boys and men. And last but not least, we want to hear from you all. We're really hoping to gather inputs from your different country contexts on how you conceive of social connection and support, the linkages that you've been able to observe between social connection support and health outcomes and gender equality outcomes, as well as some of the emerging and effective programmatic responses that you're already trying out in your respective countries. Next slide, please. So for our agenda for today, we'll open up with a resource spotlight on this knowledge product that was developed by the Male Engagement Task Force. We'll then move to highlighting 2 programming examples, Sources of Strength with Jared Hindman and Futures Without Violence with Layla Milani. Next, we'll have a panel discussion with all of these speakers to be able to hear more from them and ask them questions directly about their work before transitioning to a small group exercise, where all of us will come together to share our different experiences working in our respective country contexts. And then we'll be able to hear from each of the different groups before closing out the webinar. Next slide, please. So without further ado, I'd like to introduce Dominic Shattuck, who will be presenting on the Male Engagement Task Force Knowledge Product. Over to you, Dominic.
All right, thank you so much, Danette. And thank you everyone for coming today. This is my pleasure to present this technical brief that we recently released. This technical brief is really about friendships, and it describes how friendships impact our health. It describes some of the skills and opportunities necessary to create new friendships and to keep your friends in your life. Next slide, please. Oh, I'm sorry. Go to the next slide, please. One ahead of you. So I'm going to use my own personal relationships to start the discussion today. So several months ago, when we were developing the brief, it dawned on me how a recent hiking trip to Mount Rainier in some ways exemplifies the content of the brief. I've inserted some boxes and arrows reflecting the length of my relationship with each man in this photo. A couple of relationships go all the way back to kindergarten and middle school. My brother-in-law, whom I've known for 20 years, is in this picture. He's become one of my closest friends. And there are newer additions. One guy who lives down the street and another who attended a similar outing earlier. And then there are those guys we all met, or some of us met, when we first arrived at Mount Rainier. Situations arise in our life that provide opportunities to expand our networks of friends. We've all had awkward social situations. Walking into those opportunities, your comfort, your social skills, and experience will determine whether you're ready to build your network or not. We titled this technical brief, Building Bridges. It focuses on some of the programmatic activities that help boys and men build social skills necessary to maintain relationships and foster new ones into adulthood. The skills that are discussed today are good for everyone. And you'll see in especially Jared's presentations, they work with both boys and girls. But as you'll read in the brief, oftentimes boys especially benefit from these activities. Go to the next slide, please. Typically, our discussions about gender norms focus on how they negatively impact women's health outcomes. Today, the discussion will focus on how those same traditional gender norms negatively impact men's health outcomes and boys' health outcomes, I guess. So because social and gender norms are neither static nor universal, traditional masculinity and its associated traits are not negative or problematic by definition. So with that said, there's a great deal to be learned about how those traditional masculine traits harm men and boys. As we were doing this work, one limitation of this project is that our team was aware that much of the literature cited does not come from low and middle income countries. But considering the positive impact of these interventions that we described today, we hope that a parallel body of literature grows to describe how these concepts were applied in other settings. Go to the next slide, please. Many of you here today are aware of the man box, or the traditional masculine norms and traits. As you read down this list of those traits, I have a question. How many of these traits actually promote friendship? Autonomy, self-reliance, stoicism? None of these traits are going to build emotional intimacy with your friendships. So yeah, the answer to my question is basically none of these traits really build that supportive friendships. But these traits do have a value. For example, being stoic or competitive or even aggressive can be useful when facing acute adversity. But over-reliance on these traits can make you someone nobody wants to be around. Today, communities and workplaces expect everyone to arrive ready to work within teams, to work collaboratively, to trust one another, and to communicate clearly. An over-reliance on traditional masculine traits doesn't prepare boys and men to function in modern workplaces. And those norms and traits don't also facilitate friendships. Next slide, please. Adolescent friendships reflect the first time many children choose to connect with someone outside of their family. These friendships are an opportunity for navigating socialization and increasing independence and learning through trial and error. Friends can become the most important source of emotional and social support for children. And interventions that, and adults, and interventions that promote more positive friendship can be hugely impactful on children's lives. And as you can see in the column on the right, when boys' friendships are less rich, it can have disastrous effects for their mental health and the well-being of those around them. Go to the next slide, please. So you may be thinking, what's the health implication to these, the other health, not just mental health implication to the friendship talk? Well, here it is. We've heard a lot about the loneliness epidemic. Regardless of whether it's driven by social media, video games, or virtual reality. Our social connection to others is our lifeblood. In the US, children are reported to have the highest rates of loneliness. The bottom line is that without social connection, we are placed at greater risk for negative health outcomes. Next slide, please. So as mentioned earlier, the brief highlights 3 key elements that could be integrated into may already be integrated into your programs to foster social connection among boys and men. Next slide, please. So before I jump into the empathy slide, I have something to confess. And that is that until diving into this literature, I didn't understand that empathy was something that could be fostered or developed intentionally. I assumed that people were just either more empathetic than others or not, but I was wrong. There's a significant literature on gender transformative and school-based interventions that have shown the positive impact of developing empathy. Within the technical brief, there are descriptions of how programs implement these activities with adolescents and adults. Research has shown that when individuals develop an increased sense of empathy, they have more pro-social behaviors, they report increased emotional intimacy with friends, And when it's implemented as part of a school initiative, it can reduce levels of conflict in that school. Go to the next slide, please. Our community is well aware that communication skills are central to male engagement interventions. Developing those skills help men and women discuss sensitive topics. Well, this is no different for young boys or even older men. Modeling, practice, and activities that help men and boys engage with others will help build the bonds of friendship necessary to feel secure and supported. Studies have shown that when boys use active listening skills, they feel more satisfaction within their relationships. They have increased feelings of belonging and sense of community, and they're more likely to connect with others. And some studies have linked communication interventions with reduced rates of attempted suicide. Next slide, please. Earlier, I mentioned how many boys buy into traditional masculine traits, which impacts their ability to maintain friendships. When boys buy into masculine norms exclusively and then transition into adulthood carrying this baggage, they find it harder to maintain friendships and start new ones. There's abundant research supporting the benefits of maintaining friendships into adulthood. Today, we're linked, like just right now, in numerous virtual engagements. And studies suggest that virtual engagement is better than nothing, but it's not the same as being in the same place with the people who support you. When boys and men's opportunities to connect are facilitated, we see reductions in feelings of loneliness and isolation, reductions in chronic stress, reductions in feelings of insecurity and fear, and reductions or the reduced risk of anxiety and depression, and they have improved ability to form and maintain social bonds. Next slide, please. So within the brief, we highlight 3 programs you could learn more about for your work. I'm not going to go into them in detail here for the sake of time, but please take some time to look into these interventions. One is Roots of Empathy, and another is Program H, which is also called Manhood 2.0, and the Global Association of Mensheds. Each program provides great examples of activities that hit the 3 key elements we discussed today. There are links to the programs in the bibliography, and each of these programs is easily found on the internet. The next slide, please. So if what I've described today resonates with you, there are a few recommendations that we provide in the brief. I wanted to highlight 3 of these recommendations. First, we want to design and implement activities that provide opportunities for boys and men to learn about healthy relationship building and friendships. Also, we want to encourage open and honest dialogue about normative masculine traits and behaviors that discourage pro-social behavior. Finding out what approaches work best with which men is going to take time. And as we know, like women, all men are not the same. So it's going to take a variety of activities and interventions. And last, advocacy is always needed. And in this case, we need to advocate for policies and initiatives that promote boys and men's health and well-being. Next slide, please. So thank you for your attention. We have some great presentations coming up that build on what I've just shared. And thank you very much. And I have the pleasure right now to introduce our next speaker. If you go to the next slide. So Jared Hinman is the Chief Operating Officer at Sources of Strength. Sources of Strength is an innovative and growing wellness-focused organization that works in schools and communities throughout the U.S. And their vision is to empower a well world. Jared oversees the day-to-day operations of Sources of Strength, and he helps set the strategic direction of the organization and engages with existing and potential partners. His work integrates aspects of suicide prevention, public health, and community development expertise. And Jarrett is passionate about innovating and working collaboratively with communities to drive approaches to wellness-focused prevention and health promotion. Jared, welcome.
Thank you so much, Dominic. I really appreciate the opportunity to join you today. I'm joining you from Denver, Colorado in the U.S. It's pretty darn early, but it's a pleasure to be with you. Let me get my slides queued up real quick here. I really appreciate the introduction, Dominic. I also think it's really well aligned with what you just shared. So thanks for the excellent primer. As Dominic shared, our vision at Sources of Strength is to empower a well world, and we do that in a variety of ways. But the first, and I think the Building Bridges name really fits well with the description that we use for how Sources of Strength is different than the majority of programs that we find in the prevention space, very specifically in the suicide prevention space, which is one of our primary intended outcomes with Sources of Strength. The vast majority of programs in this space is very much risk focused, which is relevant when you talk about the data and you're trying to raise funds and get people's attention on the important topic of behavioral health and suicide prevention. But the reality is, from the standpoint of prevention and working with intended audiences, what we've selected to do as Sources of Strength is to be strength focused. In fact, one of our values is that we are radically strengths-based in the work that we do. And so everything that we do at its core is strength-focused. That doesn't mean that we overlook or don't discuss risk, but we are hyper-focused on strength. Similarly to risk focus, most work in suicide prevention is around SAD, shock, and trauma. And so we are all familiar with these approaches. We focus our efforts on hope, help, and strength. Constantly in our curriculum, we are talking with students about these three words: hope, help, and strength. And then finally, most of the prevention work that we do is adult-driven. Sources of Strength takes the approach that we are peer-led. We are a peer leadership model, and I'll go into a little bit of detail about what that model includes. But before I do that, I want to just talk to you about the core of our program, which is what we call our Sources of Strength wheel. In this wheel, there are 8 sections or 8 sources of strength that we focus on with our students. And that's from K through 12 in the work that we do. And we've done a little bit of work in higher education and in some community settings. And we are exploring opportunities to do workplace wellness. And if and when we do that, we will absolutely continue the engagement with these 8 sources of strength. And based on what Dominic was sharing just now, I really just want to share about generosity, because in the concept of generosity, we focus on things like the value of empathy, the importance of gratitude, and the importance of connection. And one of the primary outcomes of Sources of Strength post-implementation of our work are increased feelings of connection for our students, connections to positive peers, connections to caring adults, and connections to their school. All of those are protective not only for suicide, but protective for many of the other public health issues that Dominic described in his slides. And so we consider this a shared risk and a shared risk and protective factors approach. If you're familiar with the work of the Centers for Disease Control and Prevention in the US, some of their violence prevention and public health approach work is around this concept of shared risk and protection. And so it's something that we slide into really well. Also, a lot more detail can be provided around these 8 sources of strength, and you certainly can find more information if you're interested at www.sourcesofstrength.org. That website is also on my last slide. So here's the model that we take that I briefly want to describe. It's really a 3-component model, and this is for our middle and high school students. That is the peer leadership model. You have to have caring, connected, and positive adults who are supporting the peer leaders as they walk through and do this work. And so it's not just the adults who get selected, it's the adults who self-select and are identified as students as caring, connected, and positive. Second, peer leaders are absolutely required, and these peer leaders are influences within their social group. Oftentimes in school settings, the high-performing, highly engaged students are the ones who participate. We absolutely want those students to participate. We also want students from outside of those normal engaged peer leaders. So not only do we want the athletes, the students, the student council members, We want those students who are less engaged with school, who perhaps are hanging out with their friends at the skate park, who are out across the street from the high school vaping. We want those students involved, and we want the influential students from those groups involved as well to help engage those peer networks. And so these two groups, the adult advisors and the peer leaders, develop a diverse, inclusive, and collaborative community of strength. And as they work, they work on and initiate and implement strategic messaging campaigns throughout the school population, throughout the course of the school year. The way that we get there includes some training and some technical support and some sample strategic messaging campaigns that we provide through sources of strength. But all of those are designed to engage and interact with students across the school population. And what our evaluation shows us is that positive cultural change happens through this process. It's positive social norming through these networks of strength. And if the right peer leaders are pulled together, which this doesn't happen overnight in most schools, we recommend a minimum of 3 years when you engage with sources of strength. And by year 3 and beyond, the peer leadership group grows, sources of strength becomes ingrained in the community of the school, and that's where that long-lasting impact and cultural environmental change happens. We are an evidence-based program. We are in the United States on the Suicide Prevention Resource Center's Best Practice Registry. We have publications that date back to 2010. Our most recent publication was in the Injury Prevention Journal in 2023, and we are on the Centers for Disease Control and Prevention's Resources for Action. And there are a variety of different. On our website, you can find more information about our evidence base, but like I described, the impacts on those protective factors I described are rooted in evidence-based. And then finally, very briefly, I just want to share that we also more recently, so our peer leadership model has been around for 25 years. We, in the last 5 years, developed a classroom-based elementary curriculum, which is designed for kindergarten through 5th grade or 6th grade if an elementary school is set up to include 6th graders. It's the same sources of strength wheel for those 8 components, but instead of a peer leader model, it's a teacher-led classroom-based model, and the curriculum is designed at grade and age appropriate levels to talk about and engage with students in those 8 components of the sources of strength wheel. And so similar to the secondary model, we train adults, then there's a classroom curriculum, and through that engagement with the classroom curriculum, we also are working to see positive social norming. Because it's a new program, it's evidence-based and evidence-informed, but we still have research that we're working to have more research-based impacts. And so I am going to leave it there. I really appreciate your time. I'm absolutely happy to answer any questions that you have. I know there's a Q&A session coming up. But for now, I will kick it back to Dominic, I believe, to transition.
Yeah, that's right. Thank you so much, Jared. This is great. I appreciate the description of the program and the overview of activities and understanding how it's structured with those peer and adult leaders. And this is helpful for our audience to hear as we coming up, we're going to start answering questions related to this, or you're going to start answering questions related to this. So be ready. If you'll go to the next slide, please, Marcella. So I also have the pleasure of introducing our next speaker. One more, Marcella, please. Oops, sorry. I think we got sidetracked. I think it's slide 43. Okay, so I also have the pleasure of introducing our next speaker, Leila Milani. Leila is the Program Director for Global Policy and Advocacy for Futures Without Violence, where she leads their work on global violence prevention with a focus on women and children. In this capacity, she is instrumental in developing innovative policy solutions, driving advocacy efforts, securing resources, and influencing the agendas of national coalitions among many organizations, a few of which include Girls Not Brides, the Coalition for Adolescent Girls, and the Coalition to End Violence Against Women and Girls globally, for which she serves on the executive committee. Layla has traveled extensively in Eastern Africa, where she has led innovative programming around the engagement of men and boys to advance gender equality. Layla, welcome.
Thank you so much, Dominic, and the wonderful team at Breakthrough Action. It's really an honor to be here among such incredible contributors to this critical stage, this life-saving efforts that so many of us are trying to pull together our knowledge, our strengths, our resources, but most of our passion and compassion to help improve the lives of all youth and children. But in this space, we're talking about boys and men. And I want to send out my gratitude for Jared for the incredible life-saving work he and his organization are doing. This is really important. And those that are online from all these countries, I was just writing down all the various countries represented here. It is great to see the world coming together to help save lives and improve the quality of those lives. So if you could move to my slide deck, please. I'm really here to echo what was already shared, but in the context of an actual program that Futures Without Violence has been implementing in the US over a decade, and now globally, at least the last 5-6 years in different parts of the world, with a focus on Eastern Africa. Next slide, please. I don't really need to make a case for you, but I'll go ahead and set the stage in terms of what we're grappling with. We all are drawing from the same sources of data, but it's important to reemphasize that what we've learned. And what we know today is that half of the mental health challenges show up by age 14 among adolescents. But unfortunately, it takes about 10 years before most of the young people connect to the actual services and resources that are available to provide the support. So obviously, we see that the damage is taking place with the windows and opportunity to enter that space to engage in prevention is impacted by other social factors in our society. And that's kind of what I want to talk about at the outset. For men and boys, we see that it even takes longer than the 10 years for the entry point to come in. Not everyone has the benefit of programs and interventions that Jared was referencing. And that's where we want to do. We want to increase those opportunities and decrease the number of young boys who grow up with the mental health challenges that really impact their lives. And this gap in time, this gap in entry point of the prevention efforts leads to really devastating consequences. And those are that men account for about 3/4 of the suicides in the world. Next slide, please. So the work we do at Futures Without Violence is really focused around prevention. But the entry point we had was around gender-based violence and how power and power dynamics and a focused attention on advancing equality actually plays a role in the mental health of young boys and men, actually. So I want to make that link for us today, because that is an important entry point in terms of what are the factors that are contributing to the crisis for you boys and men. And so what we learned in the studies and research that many of us online today have probably participated in and helped inform is that the traditional gender roles that all of our countries, all of our cultures, and unfortunately, even all of our faiths to some extent ascribe to are these traditional gender roles that send messages to our young boys and to our young girls, but they play out in this way. And this is what happens when we try to live up to these gender norms that are ascribed to us. Those include intense life pressures, work and financial pressures on the boys and men in our societies, which impact their mental health well-being. Along the lines of that are fewer coping tools and skills, the rise and use of alcohol to numb the pain, there are these emotional conditions that are developing inside the individual, and the only sources that the media, the community is referencing and pointing to are things that numb the pain, that are not addressing the pain. I have to say, in my recent travels in Africa, and this is not to point out that Africa's challenges this, it's everywhere, but I saw so many stations and hubs for alcohol. And I'm wondering, I wish we could kind of at least adjacent to the alcohol sites or locations where it was very easy to access it, there was a place to seek help. But that's another issue for another day. Communication, men and women have different modes of communicating, and there's a certain style that's promoted for men that is not conducive to their health. And the stigma of male mental health care, getting help. Now, let's try and break that down. Why are these highlighted points that I just mentioned? What are the root causes of that? Next slide, please. So what we do as we try to help implement the Coaching Boys into Men program, as we do this training with the community of coaches and implementing partners throughout the world, what we do is we engage in this exercise called the Man Box. And the beginning of this exercise, which I'm going to offer to everyone online, is we ask everyone to write down a number of words, 3 or 4 words, that in their community, in their culture, in their social norms groups, what are the 3 words that they use to define a man, a strong man, a man? What do we say a man is? What are they men supposed to be like? And what's interesting is doing this activity for years and in different parts of the world with different religions, cultures, backgrounds, socioeconomic groups, we found that all the words used to describe what to an individual defines a man are actually identical. Whether we're in Tanzania or we're in Denver or we're in Pakistan or we're in Australia or Canada, these words keep coming up the same over and over again. And those are strong, competitive, in control, unburdened by vulnerabilities. They don't cry. They are the breadwinners. These just over and over keep coming up as the way that individuals are describing the traditional gender norms that drive young men to then present as strong, competitive, in control, unburdened by vulnerabilities. And that society, in all of our societies, prizes, values, and rewards behaviors that resemble toughness, anger, even hostility, emotional control. So when we create this box, this is what we call the Man Box, we really start to create a small space for men to be able to maneuver, to take care of their own well-being, where feelings, certain feelings are encouraged, and they're not encouraged, they're born, actually. And those feelings are, as the pressures come on, the individual feels confused, angry, scared, ashamed, alone, worthless, stupid, powerless, vulnerable, and certain thoughts come to you. Those very things that the social norms are saying we value, we don't want to see in you, are actually brewed up inside because there's no way to address it. What we do not allow men and boys to feel are, or our norms don't reward it, are compassion, love, ability to be vulnerable, ability to speak to their feelings, to seek help when they need it, to show compassion, to show caring, And all of these things are the pot in which the individual is actually having to not just live, but carry out their daily lives, but live with the pressures that are experienced. Next slide, please. So given this background and what we know in the space of gender, what we also have been doing at Futures Without Violence is working with children in general, boys and girls. And a lot of what Jared was mentioning, the program that he described was incredible, by the way. I was taking notes the whole time. And we have this similar kind of approach to the entry points of how to respond to and prevent these traumatic experiences, allow for boys to live healthier lives, allow for girls to live to their full potential. And what we found is this program that Futures Without Violence has helped in partnership with Big Brothers Big Sisters America and National Council for Mental Well-Being. They came together and put together this program called Changing Minds. And it's based on the fact that we know that nurturing, caring adults, as Jared mentioned, are important. They play a role in the lives of adolescents and youth and children. And especially in the context of boys, where these nurturing, caring adults are individuals that the boys can develop a relationship with, and strengthens the trust that the young boy has with them. They can make a difference. We know that. We have the data points to show it. And so activating and equipping these trusted peers, and I love how Sources of Strength has this, starts with the older, but really kind of quickly moves into empowering youth leaders, because that is also important. The age gap, it plays a role. A younger adult with a boy could actually be even more impactful, but we got to get them ready and prepared. So activating these trusted peers and adults in young people's lives who are actually active in some activity that the young boy cares about. For instance, soccer or American football or some kind of activity, even gaming could be the very source of connection. Next slide, please. So where all of this has come together is that this model of the mentor, caring adult, engaging with youth and boys, breaking down the social norms, and identifying ways to really elevate the spirit of the young boy, allow them to know that these gender boundaries that we've established and put on the boys are damaging, and that we can really allow for the boys to become more of a whole person and all of those other attributes. And this is part of the activity I do when we do the man box activity, is I also ask, what are the attributes we assign to women or girls? And the traits that come out are loving, compassionate, caring, nurturing, motherly. And when I transpose those on a screen and show that what we give to men and what we give to women, what we see is that if we could mix the two, if we could allow for men and boys to have all of those attributes, all of those characteristics, we actually allow for the growth of a healthier, whole human being. So that the gender piece, take that out and really focus on the characteristics that make us healthy and be able to thrive. So in the context of the program, Coaching Boys into Men, we've taken all that we've learned and delivered it in different parts of the world. And the structure is very basic. And these are the core elements that, in our conversation as we go on, we're going to talk about with you all about what pieces are important in these types of programmings. So we think, one, we kind of keep saying it, but it's important. A caring adult, a role model, needs to be part of our programs, right? Working with a small number of boys. Don't span out to 100 at a time. It needs to be this individual relationship. So in our context, in Coaching Boys into Men, it's one coach and about a number of youth that are actually size of an average team, a soccer team, around 20 individuals maybe. Numbers can fluctuate a bit, but working with a small number of boys where there is an existing relationship and an activity or a pastime that the boys like. You gotta meet them where they are. You gotta find the fire in them. Early intervention, start it early. We do have this program in the US with the high school players, football players, and other athletes. But in Africa, what we've done is deliver it to younger age bracket. And I think that's really critical. Enter early, try to address these social norms at an earlier stage. So reaching boys ages 9 to 14 to help influence the socialization of young boys to foster gender equitable attitudes is what we want to do. And this is what we do as a core element of CBIM. And the content of our program includes behaviors that promote healthy relationships and include an examination and challenging of traditional norms that increase harmful pressures on the young boys. The third piece of this is the community buy-in. So the way we do CBIM, the Coaching Boys into Men program, we start at the top where we train the master trainers and they go in and have conversations in the community with the school administrators and coaches and community leaders and church leaders to get their buy-in so that the kids that end up participating, the families and the community actually knows what it is that the boys are doing. And as we train the adult coaches and those who are delivering the program, there is a transformation that's taking place at the adult level as well. But it also helps with the buy-in. Next slide. Thank you. So these are the key messages then that we deliver through CBIM that are consistent when we train the coaches and the coaches when they deliver the content to the athletes. It's all the same. We try to increase the knowledge of what constitutes abusive behavior. We also add that we help increase in attitudes that promote greater gender equality. That's part of our content and curriculum. We also advance greater intentions to safely intervene when witnessing disrespectful and abusive behavior. And when I do the outcome results for you, you'll see where that has really made a difference in communities. And the impact isn't just on gender equality, it's actually on the boys just becoming better boys. That's all it is. And we decrease in abuse perpetration. Next slide, please. So the other piece of this that's really an important component, it's part of our secret sauce, is that the coach deliverer has to have certain characteristics. And quite often when we go into countries and try to set up the program, the implementing partners say, well, not all of our coaches, I mean, we're going to have to deliver this to 50, 60, 70 coaches. We're not going to have time to help identify these key characteristics in the coaches. And we say, no, you don't have to worry about that. As you bring in the individuals to train them to be the individuals that deliver to the athletes, you're also helping develop and strengthen these attributes in the coaches. So the coaches may have some of the strengths, not all of it, but they rise to the occasion or they identify. And we have so many stories that the coaches themselves stand up and do testimonials where they speak to their own personal transformation. And no, we didn't enter at 9 to 14 age range when we delivered that to those coaches. There could be 40 years old, there could be 35, but it is so impactful that they themselves see the change in their own individual lives. So what are the characteristics we want to either find in the individual or help nurture in the individual as we do the training of CBIM? So the coaches we really want in the forefront are individuals dedicated to developing positive character and leadership among the youth. They have to be committed to building strong relationships. They have to be willing to learn how to lead interactive discussions. They have to create safe environments where athletes can talk openly without fear or judgment. That's really important. And what that does is it allows for the young boys to really form that bond. Remember what Jared was talking about, that relationship. They feel safe, they can share with that coach. They feel safe. They can talk about their issues and seek help. And it's okay if the coach doesn't have all the answers. None of us have all the answers, but is able to next, then knows where to find support. That's what we want in that coach. They don't have to be perfect. They just have to try. Next slide, please.
Layla?
Yeah.
Can I speed you up a little bit to go to
sure.
the results so that we can get to a quick question and hear from the participants here? Sorry.
I'm sorry. It's okay. I get excited.
No, absolutely. Please, yeah. If you would move to the results, I think that's where your money is there.
Yeah, absolutely. So when we've been implementing CBIM, we can move to actually, yeah, you go ahead to the slides that presents the numbers. So thank you. We've been implementing CBIM in Tanzania for a number of years now. We've reached over 100,000 young boys. And so what we've been doing is we've been going into some of the schools to observe the delivery of the Coaching Boys into Men program. And we also have secured some data points. So as I mentioned, our objectives are to help create certain changes in the behavior of the young boys. And those were like in the intent to intervene, to have gender equitable attitudes. All of those are our objectives with CBIM. The way the schools were selected in Tanzania in terms of identifying places to deliver were schools where, and this is the slide that shows, these are just a few schools, but these are the criteria for all the school selections, just so you know. Where there was really high dropout cases of students just leaving school. And this is an early stage. This isn't high school. This is elementary age level. Truancy cases, pregnancy cases, and reported cases of abuse. These were the criteria by which the implementing partners decided to deliver CBIM in these schools. So the data points you will see is not only did we see, because we do a survey before delivery of the training to the coaches and a survey after, and we do the same with the youth before and after survey of gauging their, this shift in the social norm behaviors and practices and beliefs. We see, a lot of changes in those areas, but where we were surprised and excited in terms of numbers is what we saw was that there was a significant change in the dropouts. So let's just go down the line, one of the items per school. So dropout cases in, 51 in 2023 in Kishima school, and it dropped to 21 in 2024. So truancy cases, a high level of truancy in one of these schools, let's say 148 in 2023, dropped to 53 in 2024. And you see all the other numbers. You can have the slides to kind of assess the information. But what is really important was the conversations we had with the coaches, with the administrators, and what they told us was these, not just the qualitative, not just the quantitative, the numbers, but was the dialogue and conversations with the families. The families were saying, the parents were sharing that our boys are better behaved. They are more respectful at home. They seem happier. They're doing their chores. They're doing better in school. They're participating in conversations in class. They're more respectful to the girls. And just a whole list of these incredible outcomes we were seeing that CBIM wasn't even measuring. It was the communities themselves that are measuring these numbers because those are the reasons they are identifying the schools. So, in closing, what's really important is that all of this is, even though our entry point is the boys and the issue of gender equality, they're really linked. And the factors that contribute to this shift in behavior in every aspect of the lives of these young boys is that there is a young person, a younger person, a young coach caring for them, developing a relationship, and having these conversations about doing away with the practices and norms that don't allow for boys to feel, to love, to care, to be part of the community, and to really see the community as where they can grow and nurture and seek help and support where they need it. And I apologize for going over my time. Thank you so much. And thank you for pushing me to end it.
Thank you, Leila. So I'm going to jump in now. This is Julie Pullerwitz, based at the Population Council and George Washington University, and I am one of the co-chairs of the task force. And just want to say thank you to both Leila and to Jared for terrific presentations, and we will have the slides available later as well. Given that wanting to be sensitive as to the time and our agenda, I think I'll pose one question to you both before we move on to our small group. Thank you again for these great presentations. I was struck by, for our work and for your programs, the common themes that we're seeing, both in terms of the core elements that you were talking about for the programming, and also some of these norms and attitudes, global, that were kind of highlighted in terms of traditional norms and the power and gender dynamics. What I wanted to ask you about now, if we could think about which audiences do you think these programs or your program are best suited for? So are there particular subgroups that you would try to reach first, or that alternatively would not be appropriate for your programming, particularly when we're thinking about issues related to mental health and suicidality and some of those topics? So Jared, I wonder if I could ask you that question first.
Yeah, thanks, Julie. Very specifically with sources of strength for the program to work, it is not a simple program to implement. And so one of the things that we share with schools who are considering sources of strength is if you are not ready, if you do not have the buy-in of the leaders in the school, and you do not have connected, positive, engaged adults to support the peer leaders, this isn't the right program for you. We don't just stop the conversation there. We give them lots of recommendations for how to get themselves ready. But this isn't as sources of strength isn't as simple as coming in and doing a presentation or an assembly. It's a school year long commitment that requires commitment from administration, adults in the building, and peer leaders. The peer leaders are the easiest to get engaged, but if you engage them and then don't support them, the program's not going to work. To the first part of your question, the reality is we feel like we can implement anywhere. We are based in the US, so our work to date has been in the US, Canada, and we've dabbled a bit in Australia. But we've also had conversations with partners in South Korea and China. I did a presentation last year for UNICEF China, and is really looking at our model and seeing if there are ways to adapt it. We are not equipped as an organization to deliver sources of strength in languages outside of English and Spanish at this point, but we are always open to conversations about how to adapt or to bring sources of strength to other communities. And we think all ages, this work as adults, working on your sources of strength and your strengths wheel is incredible for adults as well, which is why I mentioned we are exploring how to create something for adults in the workplace.
Yeah, and I really appreciate your implementing and adapting the programming for younger students as well, thinking about how those different dynamics play out when you're talking about younger youth. So thank you for that. Leila, I wonder if I could ask you a slightly different question, sort of your take at this point of what kind of additional evidence or information does the field need at this point to be able to, about these types of programs, to be able to make the argument. You both did an excellent job sharing the results from your programming, but what else do you think the field needs at this point to be able to promote this more widely or to be able to take this forward?
Thank you so much. Well, I think part of a little bit of who we deliver the content to may sometimes serve as a stumbling block to the field. Like one of the earlier issues that came up was when the communities of interest in Africa, the implementing partners, a lot of them were faith-based organizations, were reaching out to try and implement this program. what we were concerned with at first was this, because this is around gender equality, some of the pushback was around those traditional notions of gender equality or the gender norms. There was a fear around, oh, are you coming in? And I even see it in some of the dialogues and the writings and questions is, are you going to be changing our boys? Are this misperception that coming in to help raise healthy boys is by definition mean they're not going to be manly anymore, or they're not going to be an important, they're not going to do the job we've been wanting them to do or we've raised them to do. And so in the field, that has come up. And what we do is we contextualize the curriculum with them. So allowing in the field for there to be conversation with very different communities is important. To not say, oh, this is the way we're going to do it. This is our medicine. Take it. We tell you it's good and you have to take it because it works. That is not a good approach. There are lots of different cultures out there. There are lots of different approaches. And so for the field to be ready, to be humble, for us to be humble as we deliver our program, and open conversation with those communities that may at outset feel like, don't come in and tell us how to change our boys, but to really go into to allow for time for the information and conversations to take place, for there to be respect for the community where you're delivering this kind of program, for them to really be able to speak to what their concerns are. Because at the end of the day, what will undoubtedly, and it has happened, that's why the government of Tanzania is now adopted CBIM. Our earlier conversations with them were around some of the nuances in the wording in the CBIM curriculum, which had to do with issues around homosexuality. So if we had shut that door, if the field had said, well, if you don't like what we're saying, we're out of here, today there wouldn't be CBIM all over Tanzania. It wouldn't. So we have to be humble and we have to meet, and the field we need to approach it, meet the community where they're at without being in a state of judgment or feeling like this is what we're delivering, you have to take it. So that collaborative spirit is really important.
Right, right.
Great. Thank you both very much. And I think I'll turn it back over to my co-chair.
Thank you, Julie, and thank you both, Jarrett and Layla. This has been super great. Those of you who can stick with us, please stick with us for a little bit. We'd like to jump into some breakout rooms, and we really want to hear from the participants about these topics and the implementation. So we want to shift our focus over to our incredible audience here. So I'll take this moment to virtually move Marcella, I think it'll take us just a moment to virtually move everyone to separate breakout rooms. We appreciate your patience. And when you arrive in the room, if you would skip to the slide deck quickly, Marcella, if you can do 35 things at once, I'm not sure. Sorry about that. Slide 58, the getting ready for the breakout rooms. Yeah, thank you. When you arrive in the breakout room, we'll ask you a few questions about the concepts, whether to integrate them, and what integration would entail. That's really what we're looking for today. You can see those questions on the slides. We'll be asking each group to identify a speaker and potentially feedback, but we may not have time for that as well. And so please remember, if you haven't already put your letter F in front of your name for a French room, please do that now. And Marcella can put you into the French room, and we will be having these breakout rooms in just a moment. And each one of the breakout leaders will be taking notes, and we'll try to use the chat and capture all of the content that's available today so that we can give everybody a nice feedback document at the end. Hello. I think that I'm going to take the closeout for right now. I think everybody's coming back to the room. I know it was too short. I apologize for that. This is a lively group, and please we can move some of this conversation onto the Male Engagement Task Force listserv. We can find ways to engage in other opportunities to kind of come together. And if we want to extend this conversation, we can figure that out in another way. There are other opportunities. I really appreciate people getting on this call today. I'm very excited about, especially appreciate Sources of Strength and Jared and Futures Without Violence and Layla and sharing their presentations. We heard in the breakout room conversations around, some of the realities that this is a needed set of interventions that will complement interventions that already exist in our portfolios, and figuring out how to get some training around this is still to be determined. But one of the things that did come out is the value of contextualization and ensuring that communities are driving that content and making it relevant to the local population. Also, in our breakout room, and I assume some of these other dynamics were being discussed, is that commitment is key to this process, and having a long-term commitment, as Jared had mentioned in his presentation, and I think Layla mentioned as well. This is not a one single presentation that happens, and it's not a situation where we have one presentation and you can walk away and the community's changed. We know behavior change doesn't work like that. It takes time, and it takes resources, and it takes scaffolding, and it takes setting up people to support other people in their behavior change and in their success. This has been a really great opportunity to come together. And as I mentioned at the beginning of my presentation, we shifted the conversation around gender norms from the harms that it does to women very often to the realities that same harms actually, not the same harms, but harms are actually implemented or experienced by men as they relate to gender norms. And so as we continue this conversations in our own organizations, as in our own homes, in our own, friendship groups, I hope that this was a good use of your time, and that you got something out of today's webinar. You feel free to reach out to myself and other members of the Male Engagement Task Force. We're quick to respond, and we're happy to link you with people you want to be linked with. So feel free to reach out, and I really appreciate your attendance today and participation in all the conversation and enthusiasm for this topic. Thank you.